This podcast is hosted by Will Glomsky. Will is an experienced critical care paramedic working on a ground ambulance. This podcast is purely educational, and the opinions reflected are of the hosts only. This show is not intended to supersede any local protocol or training. This podcast covers educational content surrounding emergency medical services. Welcome to the Midnight Medic Podcast.
Hello and welcome to the Midnight Medic Podcast, where we explore the knowledge and skills that drive excellence in emergency medical services. I'm your host, Will, and today we're diving into a topic that's essential for any EMS professional, magnesium sulfate. Whether you're an EMT, paramedic, or just someone interested in pre-hospital care, this episode will break down why magnesium sulfate is a critical tool in our drug box. So what is magnesium sulfate? Magnesium sulfate, or mag sulfate, or MAG, is a mineral compound that has a variety of medical uses in both emergency and non-emergency settings. In EMS, it's most commonly used for conditions like eclampsia, torsades de pointes, and severe asthma. It's versatile, effective, and when used correctly, can be life-saving. It's worth noting that magnesium sulfate is also used in hospital settings for a variety of other conditions, including preterm labor, migraines, and even certain cases of arrhythmias not typically encountered in pre-hospital care. This wide range of uses underscores its importance in medicine. Despite its many uses, magnesium sulfate is not a one-size-fits-all treatment. Understanding when and how to use it appropriately is key to maximizing its benefits and minimizing risks. So first up, let's talk about eclampsia. This is a condition that can occur in pregnant patients, characterized by seizures due to elevated blood pressure and other factors. Magnesium sulfate is the first-line treatment to prevent and control these seizures. It works by acting as a central nervous system depressant, calming overactive nerve impulses. In EMS, the typical dose for eclampsia is 4 grams IV over 10 to 15 minutes. Remember to monitor the patient closely for respiratory depression and hypotension. What makes magnesium sulfate so effective in eclampsia is its ability to reduce the risk of further seizures without some of the harsher side effects seen in other anticonvulsants. It also has a mild vasodilatory effect, which may help alleviate some of the underlying hypotension. When treating eclampsia in the field, it's crucial to have a strong understanding of maternal and fetal physiology. Stabilizing the mother often directly improves outcomes for the babies as well. Next, we've got torsades de pointes, or torsades de pointes, whatever way you want to say it, a specific type of ventricular tachycardia that's often associated with prolonged QT intervals. Magnesium sulfate is the go-to treatment because it helps stabilize cardiac electrical activity by affecting calcium and potassium transport in the cells. In this case, the dose is usually 1 to 2 grams IV over 5 to 20 minutes. This is a critical intervention that can help make the difference between life and death in these patients. One thing to keep in mind is that torsades can have multiple underlying causes, including electrolyte imbalances and medication effects. Magnesium sulfate addresses one of the primary contributors, a deficiency in magnesium levels. Monitoring the ECG closely during and after administration is essential. Look for the resolution of torsades rhythm and ensure the patient's heart rate and rhythm stabilize. Finally, let's talk about severe asthma. Particularly when standard treatments like albuterol and epinephrine aren't enough, magnesium sulfate can be used as a smooth muscle relaxant to reduce bronchospasm. It's not first-line therapy, but it's a great tool to have in those severe cases. For asthma, our dose is typically 2 grams over 20 minutes, but again, watch your patient carefully for side effects. Studies have shown that magnesium sulfate can reduce hospital admissions in severe asthma cases when used appropriately. It's particularly useful in patients who are unresponsive to beta agonists and steroids. Understanding the pathophysiology of asthma helps clarify why magnesium sulfate works. In severe asthma, the airways are hyperresponsive and inflamed, leading to bronchoconstriction. Magnesium sulfate helps relax the smooth muscle lining these airways, improving airflow. Magnesium sulfate can also be indicated in cardiac arrest scenarios where hypomagnesemia is suspected or confirmed. Hypomagnesemia can contribute to life-threatening arrhythmias such as torsades and VFib. Administering magnesium sulfate in these cases can help stabilize the cardiac membrane and improve the patient's chance of return to spontaneous circulation, or ROSC. In these scenarios, a dose of 1 to 2 grams IV is typically used, depending on the patient's condition and weight. Although rare in the EMS setting, magnesium sulfate can be beneficial in cases of digitalis toxicity that result in arrhythmias. Digitalis toxicity can cause intracellular calcium overload, and magnesium sulfate helps by counteracting this mechanism, stabilizing the myocardium. The dose and administration depend on the variety of symptoms, but it's worth noting as potential use cases where this condition is identified. While this is more commonly managed in a hospital, magnesium sulfate is sometimes initiated in the pre-hospital setting to slow preterm labor contractions. It works by relaxing uterine smooth muscle, buying time for the patient to reach a higher level of care. EMS providers may encounter protocols that recommend MAG in these cases, and understanding the dosing and rationale is essential. Like any medication, magnesium sulfate isn't without its risks. Common side effects include hypotension, bradycardia, and respiratory depression. That's why it's so important to monitor patients' vitals and be prepared to manage any adverse reactions. Calcium gluconate should always be available as an antidote in case of magnesium toxicity. One of the rare but serious side effects is a complete heart block, which is why magnesium sulfate must be administered carefully and only when clearly indicated. It is also worth mentioning that magnesium sulfate can cross the placenta in pregnant patients, which is why careful dosing and monitoring are critical to avoid adverse effects on the fetus. So how does magnesium sulfate work? The mechanism of action behind magnesium sulfate is fascinating. It plays a significant role in regulating calcium and potassium ion transport across cell membranes. MAG acts as a natural calcium antagonist, effectively blocking calcium influx into the cells. This leads to relaxation of smooth and skeletal muscles, stabilization of excitable membranes, and reduced neurotransmitter release. In the cardiovascular system, magnesium sulfate helps stabilize electrical activity by prolonging the refractory period of the myocardium and reducing excitability in cardiac cells. This is crucial for treating arrhythmias like torsades, where abnormal calcium handling and prolonged QT intervals play a central role. In the context of eclampsia, magnesium sulfate reduces seizure activity by depressing the central nervous system. It inhibits the release of acetylcholine at the neuromuscular junction, which decreases nerve excitability and reduces the likelihood of seizures. For respiratory conditions like severe asthma, magnesium sulfate's ability to relax bronchial smooth muscle stems from its effects on calcium-mediated contraction pathways. By inhibiting calcium uptake in the smooth muscle cells, magnesium sulfate reduces bronchoconstriction and facilitates improved airflow. Additionally, magnesium has anti-inflammatory properties that modulate immune responses. It can inhibit the release of histamine and reduce the production of pro-inflammatory cytokines, contributing to its effectiveness in managing conditions like asthma and eclampsia. On the cellular level, magnesium is involved in over 300 enzymatic reactions in the body, underscoring its broad physiological importance. This includes roles in energy production, DNA synthesis, and protein functions. The systemic effects highlights why maintaining adequate magnesium levels is critical for overall health. Like any medication, magnesium sulfate isn't without risks. Common side effects include hypotension, bradycardia, and respiratory depression. That's why it's so important to monitor your patient's vital signs and be prepared to manage any adverse reactions. Calcium gluconate should always be available as an antidote in case of MAG toxicity. One of the rare but serious side effects is a complete heart block, which is why magnesium must be administered carefully and only when clearly indicated. Here are a few practical tips when working with magnesium sulfate. Always double check your dosing and administration route. Monitor your patient's vitals closely during and after administration. Be prepared to manage side effects, including having calcium gluconate on hand. Communicate clearly with receiving facilities about the patient's condition and treatment. Understand protocols specific to your region and service, as dosing and indications can vary slightly depending on local guidelines. And be mindful of your patient's overall condition. Magnesium sulfate is not a standalone treatment. It should be part of a comprehensive care plan tailored towards your patient needs. Let's bring this to life with a case example. Imagine you're called to the scene for a pregnant woman who just experienced a seizure. Her blood pressure is dangerously high and she's showing signs of eclampsia. After securing the airway and ensuring oxygenation, you administer 4 grams of magnesium sulfate IV over 10 minutes. Shortly after administration, the patient's seizures subside and her condition begins to stabilize. This is a textbook example of how magnesium sulfate can make a real difference in the field. Another scenario might involve a patient with a prolonged QT interval and unstable tachycardia. Administering 2 grams of magnesium sulfate can stabilize this rhythm and prevent further deterioration, buying valuable time until definitive care can be provided. Finally, imagine a patient experiencing a severe asthma exacerbation. After standard treatments have failed, 2-3 nebulizers have failed to provide significant relief, you administer 2 grams of magnesium sulfate over 20 minutes. The patient begins to breathe easier and their oxygen saturation improves. This highlights the versatility of magnesium sulfate in critical situations. Magnesium sulfate is a powerful tool in the EMS toolkit, but like any medication, it requires careful consideration and application. By understanding when and how to use it, you can provide better care and improve outcomes for your patients. Thank you for tuning in to this episode of the Midnight Medic podcast. If you found this helpful episode, be sure to subscribe and share it with your colleagues. As always, stay safe out there, and we'll see you next time.